For therapies against melanoma, some of the dermatologic adverse events can be prevented. For example, the acneiform rash to MEK inhibitors, since it occurs in the majority of patients, there's already enough data showing that by using a topical corticosteroid and an oral antibiotic prophylactically, you can reduce the severity of this rash by more than 50%. So in this case, it can be prevented. Once the rash has developed, it is more difficult to treat, and one would have to use certain measures such as, again, topical corticosteroids and oral antibiotics for the acneiform rash induced by MEK inhibitors. Conversely, from BRAF inhibitors, what you get is mostly this dry skin and hyperkeratosis of the palms and soles, which can also be prevented, especially with vemurafenib, dabrafenib, or encorafenib. And in those cases, what you would want to do is use a moisturizer that has some type of exfoliant activity or softening activity in the skin, such as moisturizers containing ammonium lactate, lactic acid, urea, or salicylic acid. With vemurafenib, it is very important to prevent one of the most frequently occurring adverse events upon exposure to the sun, which is photosensitivity. These patients can get sunburns with blisters only after being in the sun for about 10 to 20 minutes. So it's very important to counsel patients against ultraviolet radiation exposure or to protect themselves when being outside.